Hello, everyone. Welcome to the 2025 Maternal Health Promotion Institute. This is the second part of our offering this week. Earlier this week on Tuesday, we had Tess Abrahamson-Richards, and we are going to get kicked off today with some updates, kind of similar to what we did on Tuesday, but in less detail. So as you join the space, please feel free to introduce yourself in the chat. I am going to be monitoring it today for Q&As and just other comments. Closed captioning should be available on this webinar, and you should have heard that it's being recorded. The recording and the resources and everything that is being discussed will be sent out after today's session, similarly to Tuesday's session. Looking at names from who's registered Tuesday to today, a lot of you are reoccurring, so thank you for coming back and spending 2 days, 2 times of your week with us. We appreciate that. But I'm going to, again, just go over some brief updates for those that maybe are new to this space. And then I'm going to hand it over to our amazing speaker, Dr. Charlene Aqpik Apok. Today's slides recording again will all be available after the session, so I'll make sure to post that in the chat as well, because that's like the #1 question we get asked throughout today's session. So I first want to introduce myself. I know that I met a lot of new folks this week, and so just grateful to be here, but my name is Chelsea Bellin. I use she, her pronouns. I'm an enrolled member of the Yankton Sioux tribe out of South Dakota, where I have family ties to the Marty area. I was born and raised on the Sampoil Valley on the reservation, the Colville Reservation in Washington State. I currently reside in Montana on the Salish, Kalispel, Kootenai people's land in Missoula, and I joined NIHB this past summer. In my role here at NIHB, I serve to lead, promote, walk alongside communities around maternal and child health and also behavioral health. You'll see my 3 daughters are on the screen. They are my drive to everything that I do as a mother, as a professional, in community. And so that leads me to my next question, which will really get us into how we can start in a good way today. So I mentioned that my kiddos really do drive me, and without their experiences, carrying their life inside of me, bringing them earthside, experiencing postpartum, I often wonder if I would be in maternal and child health. So I would love to hear why you are working in this realm, and maybe you don't work exactly in maternal and child health, but what brings you to this work, to this space, even just to today's webinar. I would love to read those stories and hear all the good that is inspiring you to do this work. Additionally, as we go through, feel free to share what land you reside on, whose territories are you joining from today. It's so cool to see so many people join and from different backgrounds. So I know it's hard, we can't respond in the chat, but hopefully you can find a name and link up with someone after the webinar. Okay, for those that are first timers, maybe to NIHB and to our webinars, we are a 501c3 charitable organization that was established by the tribes in 1972. Our purpose is to advocate for the united voices of over 574 federally recognized American Indian Alaska Native tribes. NIHB's mission seeks to reinforce tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health and well-being for all of our people. Okay, so I know we're going to go into things that maybe we already heard on Tuesday, so I'm just going to briefly touch on them, and then you'll receive the recording from Tuesday as well to hear a little bit more detail. But I just really want to emphasize that the work in maternal and child health this last year and the year ahead of us are really grounded in relational focus and re-engaging with community. As I am new to this role and into this position, I just want to make sure that I'm engaging with communities in the most respectful way to hear what is needed and where are the priorities. And part of that started with the Maternal Health Steering Committee that helped guide this work since the beginning of 2025 and into just recently in September. There was 5 experts. They supported the tribal MMRC convening in Denver that took place in June. And they also were very supportive in health literature adaptations with March of Dimes more recently. So another thing to highlight was just 2 in-person convenings. I mentioned the one in Denver, and then we also had some gatherings in the National Tribal Health Conference arena, which was the Maternal Child Health Institute. And in that space, we worked primarily around the education and discussion and growth around tribally led MMRCs, which I will go into a little bit more. But these in-person convenings, I think, really ignited this new sense of investment and passion, not just with our team at NIHB, but I think across Indian country. I'd like to think so anyways. So I want to just highlight this beautiful graphic. I shared it on Tuesday. I had a lot of great questions that came in through email. If I haven't responded to you, it's because I got so many questions after Tuesday, which I love, but it'll just give me a little time to respond. So I wanted to share a little bit more about this graphic. This was created during that session I mentioned at NTHC. What we had structured with the help of Dr. Janelle Palacios was these small group discussions with the attendees around what does it look like when we think of a tribal MMRC? Because tribal maternal mortality review committees, they do not exist right now. There are versions and variations of having representation done, but having something that's completely led by the tribes is not established at this point. And there's a lot of work moving forward to make that happen. But part of that work and how we make those decisions is getting the feedback of so many nations and so many communities. So there was discussions around what does it look like? What is our ultimate dream experience of a safe, inclusive, caring cultural approach to something that is so sacred and important in regards to storytelling, in regards to confidentiality and protecting families, which then also brought us to what are the protocols and protections that we want to see that will guide the work, that will make us accountable and make others accountable, right? And then another area was action and change. What is it going to take to have this happen, and how is it sustainable? Because right now, many of us know funding is funding is a scary concept when we don't know what's happening down the road. And so, what does long-term investment into this look like? How are tribes going to invest in this process? So this graphic pretty much we could have probably had 3 posters created, but this one sums up the breakouts of the findings and the discussions of those topics. And it really created just this sense of goal setting, maybe visionary storytelling of what these culturally attuned practices should look like, right? So this will be shared again after today's session if today's your first time seeing it. You have the ability and the right to share it as often as you'd like. You can see that it has logos on there, so you don't have to worry about asking permission from NIHB or UIHI. Okay, so again, looking ahead, NIHB is going to launch a 12-month tribal public health webinar series that's going to start in December. So registration information is going to be going out very soon. And applications for a new maternal and infant advisory committee will also be going out in November, which I plan to send those out to everybody who's registered, just so you are aware of it. So you don't have to sign up for that. I will send out the information so you can disperse it into your communities if you'd like. We're also going to expand maternal and behavioral health learning sessions throughout the year as well, and quarterly tribally led MMRC webinars. You can see the dates there. Again, all of those registration links and details will be shared soon, but there is a lot of good to look forward to in 2026, and I'm really excited to just to kick us off in a good way by having these 2 sessions this week, so we can go into 2026 just feeling rejuvenated and inspired to keep going. Okay, so I'm going to be shifting slides, so if my screen looks weird for a minute, please forgive me. I'm going to be helping Charlene with her slides and managing the chat, which I'm very good at doing both, so no worries. So if it just takes me a moment to respond to a question, please be patient. And then at the end, we will answer questions, or Charlene will answer questions mainly. But I am really excited to introduce Charlene Aqpik Apok is currently the Executive Director of Data for Indigenous Justice and the co-founder to the Alaska Native birth workers community. She has served in many spaces as an advocate for Indigenous women, sovereignty, and rights to health and well-being. Charlene is a lifelong learner in both cultural traditions, decolonizing academia. She's a mother. She's earned her BA in American Ethnic Studies with a minor in Gender, Women, and Sexuality Studies, an MA in Alaska Native Studies and Rural Development, and a PhD from the Indigenous Studies program at UAF. I'm going to hand it over to Charlene so she can introduce herself and her family, where she resides, and her communities. Thank you for being here, Charlene.
Oh, Quiana, for having me, Chelsea, and thank you all for your beautiful introductions in the chat. I'm resisting, like, I feel like I just want to be in listening mode now and learn from everyone in this circle. But thank you for having me, Chelsea. And I just want to honor this invite and that Chelsea and I met, I don't know how many years ago, maybe close to a decade, doing this work in community and being translators between research and our communities. And I just want to uplift that she thought of me and remembered us up here in Alaska, to pull us into this work that you all are doing on the ground across Turtle Island and up here in Alaska. So thank you, Chelsea. Thank you for having me. And I'm so glad to be in partnership and relationship with you and your family. I love seeing the picture of your children. So thank you for having me, and thank you everyone for joining and spending time with us. Um, I'll be sharing a little bit woven from my personal journey and my roles that I carry as a vessel, I guess, in all aspects. I'm arriving as a full person, which I want to also uplift. Oftentimes, I'm asked to speak on specifically like data or specifically this other thing. And this invite was so whole that it invited me to share from all my hats and from me as a whole person. I just think that that's really special. And so this was actually a new presentation I put together that I got to weave together all these parts of myself, and it was just a good opportunity. It was good for me to, it's a good practice for me to learn how to do that. And I'll be sharing, of course, just today, and but really my goal is to uplift the work that my colleagues are doing in these organizations and all of our community that has been supporting our organizations here in Alaska. And so while I get to speak and share with you all today, I want to really put forth that this work is being carried by many. It was created by many. I know that some of my colleagues are on the call. I also recognize some of my relatives, my cousins on the call. So I just wanted to put that forward. I'll be moving a little bit in between like personal journey and also like organizational work. So, roll with me here and thank you for your patience as I share. And so this first slide really, I was trying to think how would I present myself in my fullest. And I remembered this image from Sarah Wayland Lunn, that background of Defend the Sacred. And she has this work and so many other artwork. And I just felt like I was like, this is, if I could succinctly say what this is going to be about, it's about defending the sacred, our bodies, our lands, and our waters. You can go to the next slide. Whoops. I pressed next slide when I said that, silly. So Vanga Charlene Aqpik Apok, Chinik Mugarunga, Selena Chivik Mugarunga, Akaga Sandra Babylu Apok Ilga Evan Luklan, Savaktunga Data for Indigenous Justice Me, Suli Savaktunga Alaska Native Birth Workers Community. So what I said was my name is Charlene Aqpik. My Inupiaq name is Aqpik, which is a salmonberry or cloudberry, and it also means to be confident. My family is from Golovin and White Mountain. I'm an enrolled member of the Native village of White Mountain. My mother is Sandra Baby Lou Aqpik in the right-hand corner, and I have a 10-year-old, also known as Sun Sun, there with the fish at our family's fish rack with Anna's family here on the call. And I reside in Tekayakuk, so I am a guest on Dena'ina lands in Anchorage, Alaska. And then the other thing I just wanted to share about my introduction, I was offered this prompt one time in a webinar like this, where they asked you to fill in kind of these prompts of my people are, my ancestors are, my home is. And so I took an attempt at that for this too. So my people are Fish River and Newpack. My ancestors remember and hear our prayers and are celebrating us. My home is the scent of ayu, which is Labrador tea. My home is the crunch of frosted tundra. My home is the sound of ulus cutting through salmon. And so I just wanted to make that offering about who I am and where I'm from, and my ancestors and family, and the lands and waters that have carried me here today. You can go to the next slide. So it was a little tricky. I was like, how am I going to share about two orgs and all these things? And which one do I start with? I was like, I wish I could present this in a big circle and that would make more sense, but we have to start somewhere. And I'm going to start first with Data for Indigenous Justice and weave through a little bit by way of, again, my positionality with these organizations, my positionality within our community as a protector first, and then as a caretaker and someone who is a helper. And so I'm going to work through that. And again, I'm happy to answer any questions at the end. So feel free to put those there. I'm a pretty open book and I'm happy to answer questions. So first, I'd like to share about Data for Indigenous Justice. Our organization was founded in 2020 after really a call out for justice and attention to the issue of missing and murdered Indigenous peoples, Indigenous relatives. And in 2018, we had wanted to have a rally to call attention to this issue. And at the time, there was no list. We wanted to read the list of loved ones who had gone missing or were murdered, and there was no list. There was no way to do that. And so community organizers took it upon themselves to hear stories. And people from our community just shared story, like we know, and that's how we do things. And that became the data of what we have today in our organization was really just listening to people's stories and being caretakers of stories. And so we founded in 2020 because we know that people don't share their stories without the intention of wanting to do something about it. And so as awareness grew, um, which I think is later on a slide, but as awareness grew with that Urban Indian Health Institute, as there was a sharing, they put out that first MMIP report in 2018. And I think a lot of us were like, hey, that's happening here too, right? And so these things were syncing up across Indigenous nations and in communities. And so we formed this organization to really help advocate for this issue and see what we could do here in Alaska. And so you can go to the next slide. Actually, can you go back? Sorry, one more. I forgot to say this beautiful image. This image is the image of the stars is by Ally McKnight. And we had talked about like what is an illustration of the work that we do in our intentions and our vision to see Indigenous peoples thriving, right? So we work in this really hard area of work, but our vision isn't centered around violence, right? Our vision is centered around us as thriving people. And our mission is to equip people with the information they need, right, to self-determine change on this issue. And so we went through this story form with Allie, and she created this beautiful image as an image of our vision. And so sometimes we know that artwork can speak so much more than I can in words. And so I just wanted to uplift that artist and share a little bit about that image. It's also like on my wall behind me. But yeah, thank you. If you can go to the next slide, I forgot to mention the picture. And again, I want to uplift other leadership. It's not just me. This is my board at Data for Indigenous Justice. Dr. Jessica Black is at UAF and does amazing things in academia and mentoring students. Abigail Echohawk from Washington is also on the founding board. And of course, we know she's done a lot of work on this issue of missing and murdered Indigenous people. And we met in research, doing research ethics. And Dr. Malia Villegas is from a Fognak tribe and resides in Washington, but was previously in policy at the National Congress of American Indians. And so their leadership is just phenomenal, and I'm really grateful for them to mentor me. And if there's anything where you're like, dang, Aqpik was saying this, you could go tell these aunties because they're the ones that are my bosses, right? So I just want to uplift that there's Indigenous leadership and my team. I took off some of the slides because I have so much to cover, but I have an amazing team at Data for Indigenous Justice as well, of all Indigenous peoples doing this work here. So I was going to cover our 4 main programs at Data for Indigenous Justice, so you get a feel of what that looks like. So DIJ is currently the only MMIP specific organization in Alaska. We work with strategic partners and Indigenous-led organizations to amplify this work, and we bring our resources and talents together. But currently our organization is the only one that's specifically dedicated to MMIP. And so that looks like a lot of different things on the ground. So I'm going to share a little bit about our buckets of programming. So you can go to the next slide. And there's 4 of them. And so the first one is reclaiming data. So I mentioned, right, our story came from story. It came from our people coming together and gathering, and then we just wrote that down. That became the database. And that continues to be a need, right? We know that you all know from your communities and what you see. This is a historical issue and it's a lifetime issue. So we are constantly reclaiming data and homing that and stewarding that. And so what that looks like is lots of different things. It looks like doing Freedom of Information Act requests. It looks like gathering names like in this left picture with the hands. When we go to conferences or we do events, people can share names of loved ones that have been lost with us and we add it to our database. It can look like social media. A lot of things, people share on social media first before filing things with law enforcement. And so that reclaiming of data is a constant. And we're always doing that to make sure that we're having as accurate information as we can. And then there's some information that's available publicly, such as the unresolved cases here in Alaska, which took a lot of advocacy as well. So our first bucket is that we're constantly reclaiming this information, having that data sovereignty, making sure that we know what's going on so that we can advocate as a collective. When we first started doing this work, so much of the time, you'd hear families tell these stories and they would think that it just happened to them or it was a one-off or like this one process fell through. But I think when we have this over time and we have a collective voice to put forward, we know that it's not just that one family. We know it wasn't just that time way back then, And so there's power in our collective voice, and reclaiming that information is a really key part to that. And then you can go to the next slide. And we know that why wasn't the data there, right? We know that the systems aren't meant for us. Even the census, right? If we go back in time, the United States Census was a tool of erasure for us as Indigenous people. So the systems that we have today trickle down into data systems that still erase us and that do not work and serve us. So the second part of our programming is data systems advocacy. And there's kind of a lot of words on here, but I could do like whole presentations about data. I love logic models. I love unpacking each part. But in short, like even having a 4-race box, you all have seen that. You're either white, black, Asian, other, or native, like there's these 4 boxes that we're supposed to fit into and we don't. And so many things we get erased or we fall through the cracks in data just on basic demographics. Also a binary gender system, right? That doesn't suit us. It doesn't suit me. And so there's lots of information with data where even basic demographics don't work for us to be represented in larger data systems. So this work is under an umbrella of data sovereignty and making sure that we as Indigenous people have the information about our people for our people like we always have. We have always collected information to make the decisions about the health of our people, right? About our families. And so we do data systems advocacy. Sometimes we use the media as a tool to like really maybe uplift or to put shame out there where needed. And it works sometimes, right? We have these strategies. We put out a 2021 report, which I'll talk about a little bit later. But in that 2021 report, we called on DPS to track and release information. And now there is quarterly reports being put out here in Alaska for missing persons each quarter that is put online. We also made sure that there's mandatory reporting into a federal database, which I'll talk about on a different slide with legislation. And then implementing this center box where it says circumstance determinations. Previously, when someone went missing, they were just categorized as missing. And that could look like someone who went on a hike and got lost and hasn't returned home, or it could mean someone was abducted and that one category was called missing. And that's not going to work. It doesn't work for us to say how many cases have been suspicious or like aren't being investigated. And it doesn't work for law enforcement to allocate their resources on finding a missing person with those circumstances. And so we advocated for improved data systems and improved fields. And now these are the 4 fields that one missing category got expanded into 4. So that's just an example of some of the data systems advocacy that we do in our second bucket of programming. The third one, if you'll go to the next slide, is our fellowship program. And I absolutely love our fellowship program. This was kind of like an unofficial thing that we were doing. And then I was like, let's just really invest in our future. Let's invest in each other. Let's invest in new ideas. I can sit here and share all my ideas, but that isn't really worth anything if we don't hear from others and we learn from each other. And there's so many young people, brilliant Native people that we have in our community to uplift and to get them plugged in. And we know that this issue means so much to so many people and they want to help. And so this fellowship program was designed to bring people into the work and to meet them where they're at. So we take on 2 fellows a year, and it has looked like communications, someone has done admin, someone has done curriculum for young people. And then this year's really special. We have 2 Indigenous men who are doing a fellowship program, and they have wellness events that they are putting together in our community. And so that was a really exciting update for us, is to really bring in the men, because we know that we need balance restored across all genders, and that they are also a part of the solution. And so the fellowship program, we do 2 a year. I got a little excited, and I have 5 mentees right now this year, because I just couldn't tell people no. And when people want to be a part of this, I really want to invite them in and make them comfortable. And so that's a growing area of our work that I am really proud of. And I'm really proud of the people who have done the fellows. Antonia on the call was a fellow. So is Sabrina on my staff, and then continue to work full time in this work each and every day. And so we're really just trying to build that capacity. You can go to the next slide. And the fourth area is community building. So this heart work of missing and murdered Indigenous peoples, relatives, women, girls, Two-Spirit, whichever acronym, we all know that these are people very much loved and missed in our communities, and that the families who have lost people are forever changed, right? And so we know that we have to do this work in a good way. We have to do it with and for our people at all times. And so we do community building, which looks like eating together. It looks like beading. It looks like doing a 5K. It looks like fishing together. And this work is essential to bring survivor families together in a healing way where they don't feel so alone. It's also where we get direct feedback. It's where I get the directive from our people. If I have an event and something doesn't work, then I know I need to shift gears, right? If we hear for requests, if families want more of something, then that's where we're going to try to build up resources or raise awareness in gaps where families are experiencing. And so community building is such a central and necessary part of the work that we do. And it's really every time, like I was kind of joking, we have a lot of events going on right now across my teams. And I was joking, it sounded like a good idea at the time when we said we do all these events. And then, but I really like every time you go to an event, big or small, and our people are there and people are happy and being fed and nourished and connecting. It's like this dopamine spike, and I remember why we do it. And so that part of our community building is a really big and important part of what we do, but mostly because of how we do it. So those are our 4 programs that we have at Data for Indigenous Justice. And before I move on, I also just want to share we work as a partner to the MMIW G2S Alaska Working Group. I have a whole nother set of slides on that, but that working group is partnered with all Indigenous-led organizations like the Alaska Native Women's Resource Center, the Alaska Native Justice Center, and Native movement to really do statewide work. And so Data for Indigenous Justice is a partner with them. We meet every single week to work on this issue and do statewide work. And so I just wanted to also uplift my partners that we work with as an organization. So you can go to the next slide. And so the last thing I wanted to share was a little bit about how impactful this data can be, right? I love talking about all these smaller pieces, but kind of on a high scope. I mentioned in 2018, we had that first rally, which is the picture on the left, actually. So we heard and were given names and stories of our loved ones in 2018 in Teosri, here in Alaska, from Nikolai, and other community members put together this beautiful artwork, this huge map, and we had the names listed, which are hard to see on the picture, but all the names are there on that board. And then we put where their community, where they were from. And that was our first database right there, right? Was really us just doing that as a people. And also at the same time, I mentioned that first report by Urban Indian Health Institute. And on the right side is just a screenshot from their report where Alaska, that fourth one down, was listed as having 52 cases, right? We were reclaiming and finding that information. And UIHI put out that first report in 2018 with 52 cases listed. And so this is, I'm just going to move us through a little bit of a timeline. And then in 2020, I don't have a slide for it, but in 2020, Sovereign Bodies Institute put out a report. It's also available online. And they updated that list of what they had been tracking with 149 cases. And those jumps, right, aren't necessarily always because there's that many more cases happening each year, but it's that reclaiming of data and information from old digitized, not digitized data, I mean, to getting it digitized. It's people having cases that were misclassified, be reclassified. And so these numbers are changing for various reasons. But in 2021, if you can go to the next slide, is when Data for Indigenous Justice put out the first Alaska MMIWG report. So it's been a few years now, but in that report in 2021, the first Alaska specific MMIWG report, we reported having 229 cases of missing and murdered Indigenous women and girls here in Alaska. And so you see just briefly from 2018 to 2021, how the cases went from 52 to 149 to 229. And today our database has over 1,400 cases for just Alaska here that we have stewarded and kept today. And so that's a huge number, but I think that that really demonstrates when we as Indigenous people have data sovereignty, when we are practicing and tracking our own people, we know what's going on, right? This went from in 2018 not being able to pull a single report from law enforcement to now being able to say, this is what we know, this is our truth, and this is our story. And I think that just that short time frame, walking you through those short figures, really shows the power of data. I think that it's an important tool that we use as shared language to meet with people who might have different walks of life from us, such as law enforcement or the Department of Law. And so data is that thing that we can reach out and say, hey, this is what we have together to work off of. And that has been effective here in Alaska, which kind of brings me to my next slide. Some of the successes. So I really love to share some of, again, how powerful it is to have this information and some of the successes. So last year in 2024, with that report that we had put out and with other partners and lots of advocates and families, the first MMIP bill in Alaska was passed. And I'm just really, it like still makes me kind of choked up. I'm really proud of that. It is just the beginning. It's just the start. It's not enough. And I didn't think like when doing this work that I might even be able to see that in my lifetime, right? And so it makes a difference when we come together. It makes a difference when we use our voice. It makes a difference when we know our collective story and we operate off the truths of our people. I think that that's something too that I love to underscore is that our data will never look like the states. It will never match the federal government's data because we first and foremost operate off the truths of our people. And this bill is a testimony to that. And so we worked really closely with, again, our partners. And I have an amazing co-conspirator. Her name's Kendra Kloster. I love to shout her out. She is brilliant in so many ways and really led a lot of this with the bill. But the pieces of the bill that I just want to share, if it's useful to other states and communities, was that it mandated data entry into the federal database called NamUs. That's a no-cost budget line item. It's a good way to start having requirements for data infrastructure. And so it's something to build off of. The second one was that it secured 2 of the current 4 MMIP investigator positions into statute. So at the Department of Public Safety, our commissioner was really proactive and has resourced 4 investigators, and this helped secure those positions ongoing so that we wouldn't lose those investigators if administrations change. It also mandated cultural training for the troopers, and that is an ongoing requirement for them. And so again, we hear that like a lot of mistrust, we hear a lot of harm if outside people come into our small rural communities, and this hopefully is going to help have better communication and cultural training. And then we also have the MMIP Commission established, which they actually review cases. So it's a little different. It's a closed commission. It's not open to the public, but there is a group of people who have to and will have to report on the work being done to address this issue. And they just started meeting. They had a meeting last month, actually. And then lastly, there's also a tribal liaison position created at the Department of Law. And so we have someone positioned there that can help liaison between. And these are all, again, these aren't a sure fix to this or anything, but these are beginning steps for us here in Alaska. And I'm excited to work with partners and families to move that more forward. And so I just want to share successes. And if these are things that you are like, oh, that would be a great starting point for my community, I'm happy to share and answer questions on what that looked like for us here. And so you can go to the next slide. And all of that, right? I can talk about data and policy and program structure and things like that. But ultimately, we know that we do this because we love our people, because the people who have gone missing or that we've lost in our community are very much loved. And they were people that contributed. They were children like Ashley Johnson Barr. They were people who love to braid hair, like Cassandra Lee. And this project here is called How They Lived. And this is something, again, a part of our organization where we uplift the stories of our people about how they lived, not how they died, but how they lived, and the legacy of love that their family wants them remembered by. Because this is the work of protectors. We see the inherent value in life. We see how much potential each person brings to our community. We know that the loss of one person means we lose an auntie, we lose a mother, we lose a cousin, we lose someone who had knowledge about beading, someone who could have learned how to weave baskets, right? And so this project is on our website and our socials, and families opt into sharing the stories of their loved ones about how they lived. And this also helps build the humanizing of data for people who sometimes don't quite understand really what we're talking about when we do this advocacy. And so I just wanted to uplift that. And I think it's a good segue into the other parts of the work in our community that are happening to protect the sacred, to protect life, and to really like love our people in so many ways. And so I just wanted to share those, and the family chose these pictures of these loved ones, and there's more on our website. But I want to use that as a transition into why we also are doing this work in our community to protect the sacred around birthing and ceremonies and life stages through our organization of the Alaska Native Birth Workers community. And so the work to protect and the work to nurture and care for are both cited, right? And I think myself a little, it took me a long time to realize like, why am I being asked to do this? Why am I being called to work that looks so seemingly different? And through a lot of elder mentorship and probably patience on their part, I've come to realize my role as someone, you can go to the next slide, as someone who has been asked to be there to help transition our people, whether to or from spirit world. That's the role that I find myself in, with being around a lot of loss and grief through the work of MMIP simultaneously with the work of birthing and transitions there in life with our people. And so this image here is also an artist I really respect. She's on Instagram. I'm just like plugging people's handles here. But this is an image of the place before birth. And I feel like in my role as a vessel for people to use whatever skills I might have, I feel like I've been asked to kind of sit by an open window of our people going back and forth, and maybe they're coming to Earth or maybe they're going to spirit world. Um, and really it's that transition thing. And so we have so many roles in our community, and yes, we're protectors, we're also healers. And I think that probably resonates with a lot of you on the call and holding multiple roles. And there's so many other storytellers, weavers, right? But I wanted to just like self-identify and like help carry the transition over into this other beautiful organization that I'm going to share about next. And so you can go to the next slide, which is the Alaska Native Birth Workers community. And I am so incredibly honored to sit in circle with this group, and I wish they could all share. But this group, the Alaska Native Birth Workers community, we jokingly say we started as a text message group. um, and I wish I had time to share stories about how I got to meet and be in relationship with these amazing people. But really, it came again from grassroots. It came from my auntie calling me and saying, "Hey, your cousin's giving birth by yourself at the hospital. Can you go be there?" And I was like, "Yeah, okay." And so I started attending births and being there for people without training, right? So to say, quote, but really just being willing to be a helper and to be present for loved ones. And I think a lot of the birth workers, if they could share their stories, have stories of being natural helpers. And so this organization, we had a gathering in 2017. So you can see my timelines. I had a lot going on in those in those years. In 2017, we had a first gathering of people that we kind of knew were doing this or holding different pieces or interested in different pieces. And we came together just to sit in circle and vision and share ideas. And now we have this beautiful org, and it still really gives me pause when we get to do things with families, because those families are a part of the visioning we had many years ago, and it just really fills my heart. But our vision is to reconnect our community to birth through reclamation of ceremony, ancestral knowledge, and really practicing sovereignty from our first breaths here on Earth. And we do that by serving Alaska Native families here in Alaska and making sure that they feel well cared for, that they have all the information they need to make informed decisions about their care, about their families, about their health, and their life stages that they're at. And so you can go to the next slide. This organization was co-created with these amazing women here. So Abra on the left, Lena in the yellow hat, and then Mo. And I just love them so much, and they are true sisters. And something really special about this organization is that we practice consensus-based leadership models. And so we do everything by consensus, which sometimes makes things a little slower. But it feels really good to work in that way. And it's something unique about our organization that I wanted to uplift with this photo, and these amazing leaders doing so much. And similar to the other org, I just wanted to share a little bit about what we do in our programs, and then answer questions, because there's way too much to fit into our hour together in our time. So you can go to the next slide. So the Alaska Native Birth Workers community, we use a Three Sisters model. And so this model is The first one is providing direct services. So supporting Native birthing families anywhere from preconception to postpartum. And that looks like lots of different things. There's a lot of details about, people doing support requests or on call. We also do circles with families and cultural events. We do a craft night. We do, it looks like lots of different things, but the first one is providing free direct services to families um, who are giving birth. And so the second one is growing a statewide network of trained Native birth workers. So we're remembering the knowledge we had around birthing and ceremony together, and then sharing out that knowledge with the idea and hopes that we would have Native birth workers in each of our communities so people can give birth at home, right? Give birth on the land like we always had. For those of you who are not familiar with Alaska, we are largely roadless. And so rural Alaska, people fly in to give birth, that's really common. And so again, like our goal of having trained birth workers across the state would help ensure that birthing people and families have the support they need in community. And then the third area is kind of that big picture again, systemic, looking at policies, looking at long-term change. And that looks like lots of different things. It can look like the maternal child death review boards. There's one here in Alaska run by the state, which some of our team members have served on. It can look like building that tribal review one, Chelsea, that you mentioned earlier on the call, that so many people I know are collaborating to come together to hopefully create. We advocate for things like Medicaid reimbursement for doula services, and having direct entry midwife credentials be honored as well. And just getting more Indigenous midwives, woo woo, really cheering for them again, like that capacity building excites me a lot. And so these things look like lots of different things, but thinking long term is that kind of third sister model. And then we have a lovely comms person who put together this video with the voice of Abra. And so on the next slide, you can go to the next slide, and it's just a less than a 2-minute video about the work that we do. You can go ahead and press play.
I'm gonna make sure it plays on my computer, right? Can you give me a thumbs up if it works?
Alaska Native Birth Workers community is the only community.
Oh, don't mute yourself, Chelsea. You're muted video.
Birthing families and Native birth workers in Alaska. In our Three Sisters model, the first sister provides free, direct, and indirect services to Native birthing families in Alaska. The second sister is growing a cohort of trained Indigenous birth workers to serve Native families. The third sister supports systemic change for improved maternal health outcomes and positive birthing experiences for the families that we serve. Since 2017, we have served more than 350 families from over 70 communities across the state, and we have trained 77 Indigenous birth workers who have attended one or more of our free trainings. In our centralized medical system, rural pregnant people are required to leave their home community at or before 36 weeks in their pregnancy to give birth in the regional hospital or in Anchorage. Our team is here to welcome these families with open arms at no cost to them, so they will not be alone during the most vulnerable and sacred time of birth. Our vision is that our communities are reconnected to birth through the reclamation of ancestral knowledge, and that they exercise sovereignty from birth. Please join us on our journey.
Thank you for playing that. And that, as you saw, was on YouTube. So if you want to see it again, it's posted. And we can share that link. But I thought it was beautiful to hear Abra's voice and to see photos of our team and families that we serve. You saw a little bit of actually the trainings, which might have just looked like sitting in circle and beating. But yeah, I really think that video is a beautiful way of sharing what we do. And so why do we do this? I mean, I think you all shared plenty in the chat, like, why do you do this work and where do you come from? And I know every person probably enters this work for a different reason, and some of you put that in the chat. and we've been called to do it though. I think through one way or another, our ancestors called us into this space, into this time together right now. Is not accidental. We're meant to connect. We're meant to carry this part forward for future generations. And this is just a picture. I need to find the credit to it, but it was printed out and given to me. But it's a picture from our creation stories as Inuit people. We have a creation story where literally the earth gave us babies, and our babies would come from the land. That's where our first people came from. And to me, that's why we do this, we're so intricately tied to the land and the waters as our people. And it goes back to the start where I said, how could I describe all of this work in one? And it's defending the sacred and knowing that like we came from the lands where we say we're indigenous to, like our lands know us and we know the lands. And I just think that photo is really beautiful. And why do we have to do this work is because we were disrupted through genocide. That hardly even needs to be said on this call. I know you all know that, live that, and have that in your bodies, and that we also know and live our healing, and we also know and live our thriving. And we're reversing that one birth at a time. And to me, that's really, really powerful. Um, and so I just want to share a little bit. I'm not going to go deep into our programming. For the birth workers, I kind of high pointed the Three Sisters model. But I did want to share a little bit about, again, like how we do it, and the values and the cultural grounding that we operate off of in the work that we do here in Alaska that's been co-created by so many. And so why do we do this? You can go to the next slide. Is first and foremost, it's our birthright, right? We as Native people, as Indigenous peoples, we have the birthright to live and to thrive. It's not enough just to survive birth. It's not enough to be centered around responding and surviving trauma. And it's not enough to take that minimum of just birthing and not being grounded in all the rights that we have to enter Earth and be invited onto this Earth side from spirit world. And so we do this because it's our birthright. And I really highlight that we do this because we have sovereignty from birth in our first breaths here on Earth. And everyone who is a birthing person, families who are having children and growing families, right, have the right to have safe care. They have the right to be cared for. And we have the right to dignity. And these things seem so simple and like we shouldn't have to say it, but we know from the violence of outside systems and the systems of healthcare, which we find ourselves, that sometimes it's really hard to actually realize that, right? And so we have to remember and to assert that this is our birthright. And you can go to the next slide. Also, we know the teachings of original instruction that our bodies are our first environment, right? There's this really beautiful poem by, I think I'm pronouncing their name wrong, but Naraya Wahid. And the poem says, "My mother was my first country, the first place I ever lived." And babies being born and birthing people's bodies, sometimes women's bodies, sustain life. And everything that the mother sees while carrying a child is what the baby sees. Everything that the mother hears and what's around her is the same thing that the baby feels. And so we have these teachings where we protect a mother and the experience she has to not be inflicted around violent things or to listen to negativity, because that's what is also creating the baby. That's what the baby is also experiencing. And so we know the power of that first environment. And when we protect birthing people and ensure that they're cared for, safe, and are being exposed to an environment that's nourishing, that's generative, right? That's what is happening to the babies as well. And this is a beautiful picture by an Aqpik artist, and then a quote from an elder that shares about that original instruction. You can go to the next slide. And so why we do what we do, we know, and you all probably know and live this too, is that this work is not just about us, it's about our ancestors, both past and forward. When we heal ourselves, the work that we do here with our children, with each other, is healing us backwards and forwards, right? Forward and backwards, or whichever way you want to see that. You know, I'm kind of like out there in the meta universe, like, but we know that from our elder Rita Blumenstein, who is also a traditional midwife. But the power of that and the power that you all have doing the work that you do in whatever capacity you are is transforming our ancestors. It's healing for my grandmother, you know, who I never got to meet. It's healing for my future generations. And that's the power of this. When a mother or a family, a birthing person is being cared for during this important time in life, they influence their family's whole trajectory, right? This is a time where if they start advocating and receiving healthcare, that changes a whole lifetime of self-advocacy in a healthcare system, right? This is a time where also families might be motivated to make changes, or make healthy choices for their family. And so it's a really powerful time to do that and to work with families and to know that their community is supporting them and loving them through whatever life phase this might be. And so that goes to the next slide. We also know this like physically and viscerally. What we knew, I think, spiritually, we also know that all the eggs that a woman carries form in her ovaries when she is 4-month-old fetus in the womb of her mother. And so literally on the cellular level, we're healing generations of being connected with our grandmothers, right? We have that time of overlap where we're connected to one another, not just in a way that we know in our hearts, but also viscerally, like, right, Western science is catching up. And that doing this work and caring again for a birthing person or a person with a uterus is so powerful, and that we do that with care. We surround them with love and care. And I think I missed John, and there's like so many notes, but it's not just about a birthing person caring for themselves, it's about how we care for one another. And I think for me, as a person in our community that really needed that loving, tender care from my community to thrive, I feel like for me, it's like really trying to give back all that love and care that I receive so that I could be my best self, so I can be the person that my ancestors want me to be, so I can be this vessel for this work, whatever that might look like to our people. And so this work really helps hold that person in a gentle way, that changes generations of well-being. And so this is just, again, like a really beautiful artwork in order to say that. And then the next slide, and I'm almost done and I can answer questions, is this is a rite of passage, right? And it really goes back to all the previous work where I shared about MMIR as well, is we've always had ceremonies and rites of passage that kept us well, that honored each other, that honored the different roles that we have in our community. And these rites of passage are being reclaimed. And those are things that prevent violence. These are things that ensure that people are uplifted, right, for their fullness and who they are. And these rites of passage are ceremonies where we can get through challenges in life and know that we can do it, not just as individuals, but with each other, for each other, with our community behind us. And this is about being whole. I think a lot about what I call Inua, like our authentic spirit of who we're meant to be. And that is a wholeness. And our journey in life here is to become whole. And Rita Blumenstein, again, like she's a mega mentor to people on our team. But this quote, she says, in order for a person to be whole, they must feed their mind, body, and spirit equally to heal themselves. And so having all those forms of wellness that we need to carry our work. We have a guiding truth at the Alaska Native Birth Workers community that our children will never know a time without our ceremonies. And that's a vision and that's a truth that we strive for and are trying to create and reclaim with our people and really leave a legacy of love. Sometimes we have these childbirth education classes, and every now and then I get to go help and families where I'm just meeting them for the first time, or if I haven't even met them yet. I often tell them, I just love you so much. And I really mean it. This is a legacy of love that we're leaving behind for our people. And yeah, I'm just really proud and honored to share this on behalf of Alaska Native peoples and my family and community here in Alaska. There's really good things happening up here in the north, and it's been an honor to share with you today. I hope that you've rolled hard with me, weaving through lots of concepts and things that we're doing, but I will pause here and just next slide. Koyana, thank you for listening today and letting me share and inviting me into this space. These are little QR codes to join our newsletter if you want to follow our work. And just thank you again for being here and sharing your precious time. And I'm happy to answer any questions. Koyana.
Thank you, Charlene. I think everybody's taking a moment because we're all emotional.
I cry like every day, y'all.
Yeah. Let me see if there's any questions in the chat. Everyone is just sharing. I'm not sure if you can see the chat or not, but
I can now. I had it over on my other monitor. So.
Okay. Yeah, everyone is just sharing so much thanks and appreciation for you sharing the work and highlighting the different efforts. I'm not seeing a lot of questions, but I had a question going back towards the beginning. Maybe it was towards the beginning. The bill that you guys moved forward, you mentioned some cultural training. Was it for the police officers? Was it for their staff? I'm wondering where you are in that process of like, what does that training entail? And I know that could be a whole nother presentation, but what does that entail? And where, aside from, the folks that are going to be integrating these trainings and sharing the teachings and whatnot, where is the level of like accountability or interest in these employees to actually invest in that cultural humility in a way to make sure that it's not a checkbox, but that they continuously learn to be safe people in your communities?
Yeah, thank you. So the training passed in the bill last year in 2024. And then right now it is being co-created with different tribal organizations and the Department of Public Safety. And I live time asked this question to the commissioner not even 2 weeks ago. I said, where is that training at? And I said, and can I look at it? I said, I'm sure that you're getting lots of valuable input. I was like, and I served on the public safety committee here in Anchorage. And I was like, I've seen the opportunity for law enforcement trainings to maybe improve. And so he said that I could actually view it and give input. So I'm waiting for him to send it to me. So that's the update on that. And one of the important parts of passing that bill was to have it recurring. Whether people show up authentically, not in our control, right? But having that checkbox be recurring helps. So they can't just check it off and be done for the whole rest of their career. It is revisited and ongoing. And then what I also hope that means is that training would be updated as needed.
Awesome. Thank you. Well, we've got some questions now.
Okay, ready.
Yeah, so one says, thank you for this presentation. Are the fellowships for a certain educational level?
Nope, you don't even have to be in school. That's it. So we have opened them, and sometimes people are in school and it's complementary to the work that they're doing. And then sometimes it's actually, for example, the 2 men fellows are not currently students, but they're doing wellness projects in their community. So you don't have to. And then I've worked with students, anyone from undergrad to I have a 3rd-year PhD person. I'm on their committee, and a 3rd-year PhD psych student who is doing a practicum with us. And so it's really all levels. And I really try to just meet people where they're at. Like, what are you excited about? Let's work from there, so that's my starting point. What excites you?
I'm going to combine 2 questions into one, I think. So who trained doulas, birth workers, and how are doulas paid?
Oh, good questions. So here we have worked with many Indigenous folks to co-create, and we have our own curriculum. And so we actually do quote doula training, which I'm not going to go off on the terminology conversation now, but we do train birth workers with curriculum that we built. We also, for example, we're hosting someone to do an Indigenous lactation training, and we've done that previously. And so really, we work across Indigenous nations to share knowledge with each other and then adapt it for here. And then people who attend, like we have a part that's literally built in where we ask people, and we do this with birthing families too, like what are traditions or knowledge you've heard or been taught. And so we're always like kind of gathering and learning from one another. And then paid, yes. So at the Alaska Native Birth Workers community, our birth workers are paid. And this has been a really interesting, like as an administrator, to try to figure out, because when you're kind of leading the way and there's not a model to go off of, it can be difficult. And then you're working in these structures of like nonprofits or fiscal sponsors and all these, wonky things. And so that's something we're on the ground learning. And we actually just asked our team for feedback about things like that, because we're trying to adapt and learn about that. But yes, our birth workers at our organization are paid, and all the services that we offer to families are free of charge.
Amazing. There's a couple more. What is the status of support from the state of Alaska for Native doulas, midwives, and birth workers?
Yeah, so there are, that's part of the policy, kind of like that third sister, bigger picture. We're trying to improve more support for reimbursements. And so we work alongside our healthcare system and alongside the state system. We are not a part of it, which is a little different, but we have grown trust and partnerships with other providers and the hospital, and that has been done with a lot of care. And I think they're better understanding what we're doing, and we have a strong partnership with them, which I really love. So now they know our birth workers when they come in to support people. And so that has been a work in, something that we had to build trust and relationship with in order to do that. And it's ongoing.
Okay. There's I think maybe a final question in here. It talks about the 3 sisters model, and how do you include support from single mothers with no family versus mothers who have partners and family support?
Yeah, thank you for asking that. I'm a single mom, and so I could answer from both life and experience, but also birthing people who come to example, like they can request service support, and if they have someone supportive, sometimes people bring a parent or a cousin or any kind of person or partner. It isn't always like the birthing person's co-parent, right? And so people have shown up Oh, actually, this is a great story. We had someone come to a childbirth education class who brought their 9-year-old daughter as their support person, and it was like one of the most heartwarming and amazing experiences. So, to answer your question, we support people with where they're at, and we are a part of their support circle and network. And we kind of ask them, like, who do you have that you feel trusted with, or, things like that. And if people just don't quite have that yet in their circle, then we try to wrap them around with resources where they can get different types of support in addition to our team during this time in their life. And, my experience as a single mother, I gave birth as a single mother, and my sisters were there, and an elder mentor, and so it can be done. We're not meant to be doing it by ourselves in any shape or form, or even two co-parents, right? They're not meant to do it by themselves anyhow. It's meant to be done in community and with each other. And so piecing that circle together of support.
Beautiful. There is a question in the chat about how somebody would refer their patients who are giving birth at ANMC to the doula program.
Yeah, thank you. We have flyers there, and if you don't see them, if you go to our website, there is a support request that people can do. And so then that would get sent to us, and then we try to match folks. And then if it's a short notice, you have someone who comes in without support, we usually have an on-call available. Sometimes just we're at capacity and we have to turn the on-call off. And then if you're asking about doula program as well for training, you can follow our newsletter, and we also will share out when we're doing those trainings.
Great. There is a question about how doulas, do they work within a certain time frame, or can they work around the clock to help mothers?
So we don't want to burn folks out. I'm not saying we don't do this perfectly, but we have shifts. So people have days that, first of all, they're matched with people. And so then usually we have like expectations and kind of shared ideas about, okay, check on this person at least this many times, and be responsive. And then they have limited on-call times that we schedule as a team. And so then people also have like recovery days. We ask them to recover after birth. And then they can also tag out with our on-call team members. So let's say you're matched with someone, you're there, it becomes a very long labor, which happens. And then we can call in an on-call, and someone can trade out as well. So there's lots of different ways that we do that. Which again, we're really grateful for our team because it is hard work. People do have long days. And we try to have these recuperation times and kind of backup support too.
Great. I'd like to maybe have a call in or a call out to, the devastation that took place recently in Alaska with the typhoon. And I'm wondering, I know that there's an organization, I think it's the Alaska Community, or is it Community Foundation? Is that correct?
Yep.
Yeah, I'm wondering if you could maybe speak a little bit about what people can maybe do to help mothers, babies, families right now, if there's something you all are doing as a birth workers group, or just different resources. And I can work with your team and get something to share out, but I would love to know what's kind of happening right now.
Thank you. Yeah, Chelsea was so thoughtful. For those of you who may not know, Alaska's been experiencing climate catastrophes, and there was a second typhoon that wiped out Western Alaska. And if you look at a map, when I say Western Alaska, that's like bigger than some of the states in the lower 48. We're not talking about we're talking about pretty large areas. And sadly, some of our communities, entire villages were lost, and people are being displaced, and our community is responding, I think, in the best ways they can. And so one way is there is the Alaska Community Foundation way to donate, and then they will disperse that funding. And that is a good central way to do it. The Alaska Native birth workers, donated just from our own fruition. Like we took it upon ourselves to do that, and so did Data for Indigenous Justice. And we've been also coordinating things like nature walks, or we're actually doing a Halloween event, Go Team, for families so that they have different resources and experiences and just know that we're there for them. So yeah, there's lots of ways to contribute, but people asked us for car seats, and then we got them hooked up with the right car seats people. And yeah, there's a food drive happening. There's all sorts of stuff happening. People are definitely mobilizing here. So thanks for keeping us in your prayers.
Yeah, thank you. Well, our time is coming to a close today, but I just really, I always leave spaces like this feeling rejuvenated and hopeful and a little emotional. So I appreciate you, Charlene, for being here, for meeting with me beforehand and connecting the dots, because I remember we both were mothers around the same time, and we were navigating academia at the same time. So it's really beautiful to see us with our children and just in these different spaces in life. So I appreciate you. I appreciate the work that you're doing, your team, everybody. And I hope everybody has a great afternoon.
Take care, Koyana.